If we can find it, we're buying it. If we can't buy it, we're going to make it or repurpose it. As I've said before, we are much, much too reliant on foreign countries.
Meanwhile, the governor says the state will do whatever it needs to do to acquire PPE for Ohio's healthcare workers. We know a shortage in equipment could put those workers at risk. As they continue to be pushed to these new limits, there are new questions about just how far hospitals can go. News 5's chief investigator, Ron Regan, has been digging into the legal rights healthcare workers are entitled to.
Healthcare workers are doing whatever they're asked and beyond to save lives. But questions are beginning to surface over whether hospitals are placing their lives at risk. Matt Besser is an employment rights attorney.
We're getting a lot of calls from pregnant employees. We're getting a lot of calls from employees with existing health conditions. And these two categories of folks are obviously extra vulnerable to exposure.
Hospitals have occupational and injury rates twice the national average. Now, a pandemic.
If an employee works in a high-risk job, in a job with high risk of exposure, and they're not getting personal protective equipment, they might have the right to refuse to perform certain tasks.
But circumstances vary, and so do legal protections.
If you work in, say, patient transport, where you've got to get face-to-face with patients, and they're not even giving you a face mask, something to shield your eyes, you've got a decent argument that you've got a right to refuse to work.
Then there are healthcare workers simply being reassigned to high-risk areas.
In terms of involuntary moves, in the healthcare setting, by and large, the employer is going to have a fair bit of leeway to reassign folks.
And federal workplace safety laws like those under OSHA provide only a limited right to refuse to work, and then only with imminent death or risk of serious injury. I'm Chief Investigator Ron Regan.